First, I think it's important to recognize that medicine is still in the early days of understanding all of the best use cases for MCF-DNA testing, in particular BAL testing, as well as the use of paired testing where both plasma and BAL fluids are sent for cell-free DNA analysis. Regardless of the analyte, with MCF-DNA testing, it is particularly important to consider the pretest probability that the test will provide useful information and clinically impact or change management in your patient. MCF-DNA testing is broad and quite sensitive, and the data suggests that MCF-DNA testing is the most valuable when it's used to answer a specific clinical question. For Karius Spectrum, the major advantage is that it's non-invasive. As a plasma-based test, it can be deployed if there is a question regarding the nidus of an infection, if the patient is too unstable for an invasive procedure, or if bronchoscopy cannot be obtained in a timely fashion. On the other hand, Focus BAL has the advantage of directly sampling the site of infection in those patients for whom pneumonia is suspected. In that setting, direct sampling of the site has a strong biological rationale, and collection of a BAL MCF-DNA specimen can be easily integrated into the existing diagnostic and therapeutic bronchoscopic workflows. There are also scenarios where both may make sense. For example, early in the course, before bronchoscopy is available, Spectrum may be useful as a non-invasive test and can be sent quickly. Then, if the patient undergoes bronchoscopy and ongoing clinical concern remains, BAL can be added to add site-specific information. This can be particularly relevant when there is concern for pulmonary infection, but also the possibility of a disseminated infection or a non-pulmonary source. With all that in mind, there's still much to learn about the clinical utility of BAL MCF-DNA testing.